Mental Health, Social Norms, and Stigmas by myself, Jacob Wood. So some context before we get into it. Mental health is, as we know, a worldwide issue, and it's been recently new in the past couple decades. The Center for Disease Control states that 50% at one point in their life will be diagnosed with some mental health disorder, and this doesn't even take account for the people who will not be diagnosed with a mental health disorder. And then the American Psychological Association pulled up a study that said that children today undergo more psychiatric or psychological stress than 1950 psychological patients. And furthermore, in this adolescent demographic, the different genders, male and female, they are held to different standards in today's society. And this can be because of how society perceives the different genders. And then parallel with these societal norms are the perceived stigmas. These norms that are based around these genders, how one should act in society, what's normal. All that elicits a perceived stigma based on these children's actions. And this led to my research question, which was, how do the different adolescent genders see divergently on mental health societal norms and these stigmas that could ensue? Looking into lit reviews, I decided to choose 3 on my research paper that persuaded my methodology the most. This first one, Adolescent Gender Role Identity and Mental Health, Gender Intensification Revisited. This is by Priest, Lindenberg, and Hyde. Even though this was done in 2009, it's still very relevant, and it was one of the more first thorough research mental health studies done. The method they conducted was they had participants complete a number of questions via survey. And there were questions about general identity and depressive symptoms after these big life events they've had. And they carried out quantitative data. And what they found were that genders these participants were most surrounded by is how they elicited their actions the most. And it encouraged for girls to take on more masculine traits than it did for boys to take on more feminine traits. My second study was Attitudes Toward Professional Psychological Help Seeking in South Asian Students, Role of Stigma and Gender. This was by Aurora, Metz, and Carlson. This was done in 2016, so a little more recent. The method they conducted was they measured perceived and personal stigmas of individuals using scaling instruments to measure how respondents would react to a help-seeking environment. And what they found was that personal stigmas affected help-seeking, and perceived stigmas did not affect seeking help. And being male was associated with negative attitudes towards seeking help for your mental health. This one affected my methodology because they used these different Likert scales to measure perceived stigma. I will not be looking at personal stigma. My last source was Anxiety-Specific Mental Health Stigma and Help-Seeking in Adolescent Males. This was by Clark, Hudson, and Hayter. This was very recent, done in 2020. And the method they conducted was they used vignette method that inspired my methodology the most. And they used open response questions. What they found was that males do not stigmatize clinical health patients, and that patients with normal levels of anxiety, more stigma is elicited upon them. This study, like I said, inspired my methodology the most through these vignettes, which I will talk about on the next slide. So the methodology conducted, I will carry out descriptive research, which is finding characteristics or situations from your study that you conducted, and I will be looking to find gender differences through a method that combines my 3 lit review sources. I will be carrying this out via survey, and I will be using concise vignettes or short stories displaying societal norms, and I want to elicit a response based on the perceived stigma of my respondents. I want to ask, to elicit this perceived stigma, I'm asking how appropriate is the actions conveyed in these vignettes, And then I follow with another statement asking if these actions conveyed in the short stories go against my respondents' societal norms. And I recorded this using a Likert scale. So results. Here's an example of what some of my questions looked like. I used two different characters, Mark and Tessa, to also kind of shift the data between males and females. So Mark has been feeling down lately for no clear reason. Is it appropriate for him to feel this way? Tessa's been feeling down for no reason. Is it appropriate for her to feel this way? 79.4% either strongly agreed or agreed with Mark, feeling it's appropriate for him to feel down for no reason. And Tessa, 81.9% agreed with her. But when I took kind of the same scenario and I added more details, such as he's a hard year due to the divorce of his parents, the death of his grandma, being isolated during COVID-19, the data shifted to 95.1%, feeling it was okay for Mark to feel a certain way based on these actions. I also asked if these things go against societal norms. I had a question, or I had a short story about Mark and Tessa getting plastic surgery on their nose because they felt like it was needed. And 28.5% disagreed, or agreed that it went against societal norms for Mark to get plastic surgery on his nose just because he wanted to. However, when I gave a reason that he had breathing problems, it shifted to 22.5%, only disagreeing that Mark's actions went against societal norms. These graphs display every question about percent appropriateness and going against societal norms. The pink represents females answering and the blue represents males. As you can see from the graph on appropriateness, females were at the top most of the time except for 3 or 4 questions, and for societal norms, females want to be lower because that means you're more accepting of these actions. So females again were lower in these portions. Again, I separated it into just Mark questions and just Tessa questions. Females again higher up for all of Tessa's questions and just a few of Mark's. This last graph represents these different scenarios broken into groups because there's scenarios where it was both Mark and Tessa. What I want to point out is that there's only one time where males were more accepting than the females, and this was during Mark's plastic surgery on his nose for no reason. Another big data point that I wanted to point out was that therapy shame. As you can see from the graph, it is almost half of what some of the other graphs are based on appropriateness, which I will touch on this later. So what are some of my implications from my data? Societal norms are shifting. I've been, based on my vignettes, I wanted to elicit perceived stigmas. So all the questions I wrote, I was trying to get people to disagree with what was going on. And based on my results and the graphs, this did not happen. All the respondents were very accepting of what was going on. Furthermore, females were more accepting with perceived stigma than males. Females were higher up on every chart. It wasn't a huge gap, but they were more accepting of these short vignettes with both Mark and Tessa. Many understand emotions, but they don't totally know what to do with them. I asked a question about feeling shame for going to therapy, and this elicited my lowest response of appropriateness in the whole study. And relationships with my previous research, I did find some similarities and some differences with this research that's been done in the past few decades. The idea is that males are more criticized was buttressed through my study. Males are still in society more criticized than females, just like it was a few decades ago. Another idea that was buttressed was people hold more stigmatizing views on non-clinical mental health patients than they do on diagnosed patients. And this also can relate to reasons, me giving reasons why certain either marker tests feel a certain way about a situation. One thing that was, again, different about my study that was not found in previous research was that societal norms are shifting. In previous research, they either studied the actual societal norm aspect or the perceived stigma aspect. They didn't combine both. And through combining both, you can see that this elicited stigmas was not as it should have been based on how I was writing, and that many were very accepting of what was going on in these situations. Some limitations to my study was that all the questions and statements that I wrote for the societal norms was formed on my subconscious bias. These views that Mark and Tessa were going through were how I see societal norms as a male in society. So what I see as societal norms could be different from what my respondents see. The demographic of where my data was gathered can also have an effect on my study based on, I only use males and females from a private school where views of mental health are accepting and you want to be more inclusive. Another limitation was the terminology of my statements in the survey. When I asked if it was appropriate, I said it is appropriate for him/her to feel this way. But when I asked for societal norms, I asked if this goes against societal norms. And even though the Likert scale was still in the same strongly disagree, strongly agree, but my first statement was a positive connotation, followed by a statement with negative connotation, so it could flip how my respondents see the questions and the Likert scale. And my last limitation was I'm dealing with adolescents. This is a smaller limitation, but adolescents are less likely to take a mental health survey more seriously than an adult demographic. Some further research, I could do a preliminary survey to eliminate the subconscious bias I have in my survey. So I can ask how my certain respondents feel about their societal norms, and I could take different examples from them to use as my vignettes. I could expand my research to public schools now, where values of inclusiveness are not totally as standard as they are in private schools. And then I could also conduct research on an adult demographic, where they've grown up in a society where mental health wasn't totally pushed as they were in adolescence. Thank you.
Terrific. Thank you, Jacob. I've got a couple of questions for you, and then we can wrap up. So for the first one, how did you determine which results that were generated through your method were the most important to inform your new understanding? Tell us about how you made that decision.
So figuring out what results were most important, I first just gathered just medley of just all my results I found. And then by looking back at my previously reviewed sources and what they thought was most important, I kind of saw, okay, this is similar to what they found, this is different to what they found, and just the biggest kind of correlations to these previous data and biggest correlations to just differences and like the biggest gap differences between the genders is what elicited me to what I put in this presentation as the most important results.
Okay, terrific. And then as a follow-up to that, how does your new understanding address the gap in the scholarly conversation? In your lit review, did you identify any areas that weren't explored that you think your research did explore?
So, like I said in my methods, what previous research hadn't done was mix societal norms and perceived stigmas. What they did was either just one study on each, but by me already putting in the societal norm and eliciting my perceived stigma, I was able to connect the both through the two different genders, and I can now see, like you clearly see, like how the different genders see divergently on certain mental health situations.
Perfect. And then the final question, what do you think was the most important research skill that you gained while you went through this process? And what do you think that skill will help you with in the future?
I think the most important skill I've learned throughout this research is that you need to be able to be patient, patience with your respondents, patience being able to thoroughly research what you want, and just overall being really just immersed in what you're doing, having the time to spend on researching what's going on in, for me, mental health, and how adolescents feel, how the different genders feel. Just having that patience in your day to be submerged in the area.
Terrific. Thanks.